Marking the 50th anniversary of the expanded program on immunization in Africa, some who attended the event and who have benefited from immunization and vaccines expressed joy, especially the elderly who received flu vaccines as winter begins.
It was easy, it was no problem.
Parents with small children, especially babies, are encouraged to take their children for routine immunization to prevent deaths from childhood diseases.
It's not only women who takes children to clinic or whatever for their health. As women, we should do the same.
The commemoration also coincides with the 10th anniversary of the human papillomavirus HPV campaign launched in 2014 to vaccinate young girls at the age of 9 to prevent cervical cancer. Over 6 million doses of the life-saving vaccine have been given to young girls in the past decade.
It is provided as an on-site service at school, also to injections. The second injection will be given 6 months after the first dose.
The African Vaccination Week is observed annually in the African region to increase awareness. Diseases such as malaria and measles remain a concern for the World Health Organization, but a simple vaccine can make a difference.
Number one is, for example, malaria. Malaria still, to me, gives a really sleepless night. Malaria is a 95% a disease of developing countries like Africa. Of course, in South Africa, not many provinces have malaria, but at a continental level, we still lose so many children because of malaria. And we have vaccines for malaria. So my major areas of concern is really particularly in the rural settings. We are yet to reach most of the vulnerable populations, particularly in the rural settings.
The other barrier to immunization in South Africa, but also elsewhere, is sometimes the fact that mothers, young people come to a health service, a health center, and there are no vaccines. There is a stock out because there is not a proper management of the supplies to a given healthcare center. So we want to work with the government of South Africa, or continue to work with the government of South Africa and our partners to make sure that the supplies are always there.
South Africa is sitting at an immunization rate of just over 80%.
On average, if you take measles as an example, we're hovering around 85% on average. I think, as I say, we would love to be at 99.9, if not 100%. I think it's just a human factor. We are getting into winter, flu is coming, various variants of flu, influenza. So for people with advanced age over 60 with comorbidities, we do also provide, flu vaccines in the public facilities. So we urge people who are at risk to please come forward, approach your clinic. If they're out of stock, they will be able to get it and make sure that you are protected.
The 2024 campaign was commemorated under the theme, The Big Catch Up, Vaccinated Population, Healthy Population. Patricia Phaahla, SABC News in Hebron, outside Pretoria.